بسم الله الرحمن الرحيم. السلام عليكم. الأستاذ الدكتور مدر حسن نور الأعرجي. أعزائي الطلبة، أقدم لكم اليوم محاضرة جديدة بعنوان Malnutrition، سوء التغذية. It is an important subject in pediatrics and it is considered as a primary cause of morbidity and mortality in children in developing countries. Now, we start with etiology. First, unavailability of food or inadequate food supply. فادزم يعني المجاعة. Second, bad cultural food practice such as use of food with low protein and calories as weaning food. تعرفون احنا the most important cause sometimes in malnutrition هي ال weaning food. هذا طبعا بالفترة الحرجة in pediatrics. Sometimes حسب الثقافات يعني أو يستخدم food with low calories such as bread, tea and biscuit. These food with low calories. أغلب الأحيان احنا أحيانا نلاحظ أنه الأم تستخدم الخبز as weaning food أو أحيانا تستخدم بسكويت with tea or اللي هي موجودة في يعني بلداننا. Third, early displacement of infant from breastfeeding. Due often to believe that infants should not be nursed if the mother is pregnant. احنا in supporting of breastfeeding we said even if the mother pregnant she can continue with breastfeeding. هنا الاعتقادات انه the mother often believe انه should stop breastfeeding. فهذا one of the causes of malnutrition. Number 4, failure to initiate or early cessation of breastfeeding. فشل الرضاعة الطبيعية. لذلك احنا أصرينا بالمحاضرة السابقة أنه how to support breastfeeding، وحكينا عن أنه initiate early breastfeeding for successful breastfeeding. Now, number 5, malabsorption state like chronic diarrhea and chronic parasitic infestation. One of the most important cause of malnutrition is chronic diarrhea. 6, abnormal loss of protein such as nephritis, burn. Number 7, failure of protein synthesis as in chronic liver disease. Now, classification of malnutrition. We divide the classification to 3 types of classification. First, according to the percentile, using a growth chart. We know there is many types of growth chart. One of the growth chart, age for weight, height, age for height, or height for weight. In these, when we use this chart, there is below the 3rd centile or below the 10th centile or below the 25th centile. هاي السنتايل موجودة هي طبعا 7 لاين، الميديان بالنص و 3 لاين above 3 لاين below. هسه احنا نحكي على اللاين below. نبدأ من يعني the last degree هي 3rd centile، بعدين ال 10th centile above the 25th centile. The other type of classification according to Z score. This is by using the normal distribution curve of the population. هذا نسميه ستاندرد ديفيشن. هذا الكيرف يسموه بير لايك شيب كيرف. هذا الشكل المقوس، الميديان يصير بالنص. طبعا بلو اللي minus 1 standard deviation و minus 2 و minus 3 standard deviation. As we mentioned above, minus 2 standard deviation equal to 3rd centile in the growth chart. Now we come to other type of classification. It is the international classification, which is the most commonly used. In this classification, we divide malnutrition to 3 types. Sorry, 4 types. A, marasmus, when the body weight for the patient below the 60% of the median weight for his age and sex without edema. يعني عندما نقيس وزن الطفل نلقاه below 60% of the median. Now second نلقى واشيركر his body weight below 80% and above 60% of the median weight for age and sex with edema. Previously we said without edema, with edema. C. Marasmic kwashiorkor. His body weight below 60% of the median weight with edema. Number 4. Underweight. Below 80% and above 60% of the median weight without edema. هنا نقول underweight. هواي يغلطون يقولون under nutrition. لا، هو كل هذا يسموه under nutrition. malnutrition other name هو under nutrition. هنا نيم underweight، يعني تبع على الويت حتى واحد ما انساها underweight. توضيحا شنو معنى 60% و 80%؟ اعطيك اكزامبل. عندنا مثلا الميديان weight for example 1 year old infant. his median weight 10 كيلوغرام. ال 60% هي 6 كيلوغرام. اذا below 6 كيلوغرام نعتبره below 60%. ال 80% 8 كيلوغرام. above 80% يعني 80% عفوا below 80% يعني below 8 كيلوغرام وهكذا. هاي المصطلحات اللي نستخدمها. Now, what are the clinical features of malnutrition? First, initially there is failure to gain weight. Then there is loss of weight. When become more severe, there is loss of weight. Second, skin become wrinkled and loose as subcutaneous fat disappears. ليش يصير لوز السكين؟ لأنه الفات disappear. 3. As fat is lost from the sucking part of the cheek, then fat face give an old appearance between two brackets wizen face. wizen face يعني وجه ذبلان يكون معناها wizen face. 4. Generalized muscle wasting. This is the most characteristic sign of marasmus. The infant looks very thin. His leg look like sticks. Muscle wasting most obvious are the buttocks, then deltoid, arms, and intercostal muscle. As if we ask you the first side appear in muscle wasting, you have to answer buttock. أول ما نفحص احنا البuttock أو internal aspect of the thigh، هاي أول ما يبدأ بيها الويستنج يكون كلش واضح. then طبعا ينتقل للدلتويد وراها الارمز والانتركوستال muscles. Number 5 in the clinical feature, the abdomen is distended because of abdominal muscle weakness. Number 6 in a clinical feature, hypotonia because of muscle wasting. Number 7, the temperature may be subnormal and the pulse is low. يعني liable for hypothermia or bradycardia. Infant first fretful and later become listless and the appetite is diminished. يعني أول شوف دائما الطفل يكون عبوس fretful and later become listless and the appetite is diminished as the picture below. Now, 9 edema, which is the main sign of kwashiorkor. يعني the most important feature in malnutrition you have to examine for edema حتى تفرق تقول هذا kwashiorkor, which is noted first on the legs. شوف الإدمة ما تبدأ in the legs, then on the arm and face as the child condition is worse. The 10th clinical feature in malnutrition is dermatitis, which is common, especially in kwashiorkor. Mean darkening of the skin appear in the irritated area, but not in those exposed to sunlight. حتى نفرقها من a condition called pellagra. شوف converse to that in pellagra. Pellagra mean rough skin, which is due deficiency of niacin. Now, we start with complication of malnutrition. First in the complication, decreased immunity and increased susceptibility to infection like UTI. The most common infection هو UTI, then pneumonia, then otitis media and TB. Second, diarrhea. Another complication of malnutrition هي diarrhea. طبعا diarrhea lead to malnutrition and malnutrition lead to diarrhea. It is vicious circle. So that was diarrhea was the condition and it is vicious circle. The diarrhea may be due to infection, which is either viral, bacterial, or parasitic, or due to lactose intolerance or bacterial overgrowth. Third, hypoglycemia, which is dangerous, lead to brain death if يعني prolonged. Four, hypothermia, decrease in body temperature. 5, anemia, which is either due to iron deficiency, B12, folate, and copper deficiency. Number 6, other macronutrient deficiency and vitamin deficiency lead to like eye complication, like cirrhosis, بايتوت سبوت, كيراتوميليشن and blindness. إن شاء الله بصورة أوضح البايتوت سبوت. Rickets and gum hypertrophy due to vitamin C deficiency, ricket vitamin D deficiency. Now, the seventh complication, which long-term complication, like mental and physical retardation, and maybe permanent. Eighth complication, heart failure. Heart failure either due to anemia or due to cardiac muscle change or selenium deficiency. Now, assessment of patient with malnutrition. طبعا first we start in the management. The first point in the management is assessment of patient with malnutrition. First, history and physical examination. We take nutritional history. نسأل عن history يعني type of food intake. Important part in assessment of malnutrition. History of diarrhea and vomiting مثل ما قلنا sometimes because of chronic diarrhea. Now, we look for symptom and sign of infection. Look for sign of malnutrition. مثل ايش؟ like مثل wasting of muscle and edema. قلنا الإديمة very important in assessment of patient malnutrition حتى الفقر وشركة أو مرض. Look for sign of heart failure. sign of heart failure تعرفوها هي مثل tachycardia, tachypnea, and hepatomegaly, high sign of heart failure. And when there is heart failure, look for the cause of heart failure. Maybe anemia, maybe fluid overload, maybe thiamine deficiency. تعرفون الثيامين deficiency يسوون الديزيز يسوون بربري. البربري تو تايب اكو دراي بربري وويت بربري. الويت بربري هو due to يعني الإديمة اللي because of heart failure or cause of heart failure may be selenium deficiency. In the assessment also look for sign of anemia اللي هي البلر. either anemia may be because of iron, folate, vitamin E deficiency or copper deficiency could be the cause. Look for the sign of macronutrient deficiency. مثل ايش هسه قلنا هاي البايتوت سبوت. لاحظ هاي الصورة هاي sign of vitamin A deficiency. The other sign we look for when the eye affected can be caused by vitamin A deficiency, zinc, vitamin E deficiency. يعني when we find eye affection like مثل cirrhosis ما قلنا cirrhosis, بايتوت سبوت, كيراتوماليشيا, then when you find look for يعني maybe caused by vitamin A, zinc or vitamin A deficiency. B, dermatitis. When you find dermatitis, you think about deficiency of vitamin A, B2, B6, biotin, niacin, zinc or fatty acid deficiency. Ankylostomatitis, تشقق in the lips with stomatitis in the mouth. This is maybe caused by iron, B2 or niacin deficiency. Glossitis in the tongue may be caused by B6, B2, B12, biotin, iron, folate or niacin deficiency. Chelosis means تشقق الشفة. May be due deficiency of B6 or B2 deficiency. look in this picture glossitis. هذا الكيلوسيس نقصد بها الكيلوسيس واضح بالنسبة طبعا هاي it is very important هاي deficiencies sometimes come in MCQ question يعني مثلا احنا نجيب example the glossitis caused by one of the following اكتب لك مثل واحدة من ذني true والبقية اكتب لك false. The treatment of patient with malnutrition. After the assessment, we come to the treatment. First, measure to prevent and treat life-threatening condition. طبعا نبدأ early هو life-threatening condition treatment. Look for dehydration. Give rehydration. If there is sign of renal failure, look for sign of shock and treat the shock. Treat anemia. Treat hypothermia. Is danger hypothermia, hypoglycemia, danger, eye sign and macronutrient deficiency. Treat this condition. Then B, treat infection. We use effective antibiotic like penicillin. طبعا effective and broad spectrum antibiotic like penicillin for 5 to 10 days يعني شوية long duration or according to the result of the culture better in the culture. C, the cornerstone of treatment here feeding. Oral feeding started with frequent small feeds or diluted milk and the gradual to the diluted milk. The strength and volume are gradually increase because if rapidly give high calorie there is complication GIT upset there is hepatomegaly also so we start gradual increase and frequently decrease and the frequency decrease over the next 5 to 6 days. Now, and in other words, we start in terms of calories 50 calories per kg. شوف gradual start with 50 calories per kg to reach at the end of the first week to 150 calories. ما تنحل بالكالوري reach to 250 calories per kg. هنا يعني نقصد بها المول of milk. بس better than the calorie in the 50 calorie increase حتى even reach to 250 calorie per kg. The normal requirement of calorie هو as we mentioned previously 80 to 120 calorie per kg per day. يعني average 110 calorie per kg per day. Now in the recovery period high energy food made with milk, oil, sugar are needed. Vegetable fat is absorbed better than cow's milk fat. And we give vegetable fat better. Vegetable fat. Vitamin A or other vitamin and minerals, especially vitamin A, potassium and magnesium sulfate, 0.2 ml per kg for 3 days. It is important. Give iron, folic acid, and vitamin B group should be given. Now, sometimes there is causes of fertility response treatment. Sometimes we give the child the treatment but not response. Why? There is causes, 3 causes main important. Feeding problems, not problem in feeding. Missed associated condition like infection with UTI, TB. 3 psychological causes like emotional deprivation. If we give him attention and affection, affection, and the child need love, affection, he start to eat and increase weight. Thank you very much.